Diagnosing UTIs in NLUTD. UTIs are bladder or urethra infections caused by harmful bacteria that can come from outside or replace the bladder's normal bacteria. Women and people with NLUTD are at higher risk due to shorter urethras, urine retention, catheter use, and bacteria moving from the rectum during bowel care. Cloudy or smelly urine may result from the bladder's natural defenses and doesn't always indicate infection. UTI diagnosis in NLUTD is challenging because lab signs like bacteria or white blood cells may appear without actual infection. Symptoms are essential for diagnosis. Lab results alone are not enough. Key urinary symptoms include urgency, frequent urination, incontinence, weak stream, bladder spasms, or changes in urine appearance or smell. Systemic symptoms including fever, pain, nausea, fatigue, confusion, or new muscle issues may indicate true infection. Watch for catheter site irritation and autonomic dysreflexia in SCI patients, which can signal a medical emergency. Clearly report all symptoms when seeking care. You'll likely need to provide a urine sample. Urinalysis checks for signs of infection like white blood cells, blood, or bacteria, and urine culture grows bacteria to confirm the infection and guide treatment. For more information, see our fact sheet on managing NLUTD.